Anatomy, abdomen and pelvis and bladder. Embryology. Bladder is mostly a mesodermal organ. So what is the embryology of the urinary bladder? It is mostly a mesodermal organ, but it contains some endoderm as well. So even some endoderm is also there. So between weeks 4 to 7 of fetal development, between which weeks 4 to 7 weeks of fetal development, the cloaca, it divides into urogenital sinus ventrally and the anal canal dorsally. Okay, bladder is mostly a mesodermal organ, but it contains some endoderm as well. So between weeks 4 to 7 of fetal development, the cloaca, it will develop into urogenital sinus ventrally and anal canal dorsally. So the urogenital sinus, it is continuous with the allantois anteriorly. So urogenital sinus, it is present ventrally and anal canal dorsally. So this urogenital sinus, it is continuous with the allantois anteriorly. So the base of the allantois, it expands. So this urogenital sinus, it is continuous with the allantois anteriorly. So the base of the allantois, which one? The base of the allantois. So this expands and develops into the bladder. The base which develops into the bladder, the base of the allantois expands and develops into the bladder, while its anterior portion gives rise to the urachus. Okay, base of the allantois is developing into the bladder, while the anterior portion, it is giving rise to the urachus. So the urachus, this later develops into a fibrous cord. So how does this urachus later develop into fibrous cord? So this is the median umbilical ligament. The urachus, it later develops into a fibrous cord, the median umbilical ligament. Through mechanisms not clearly explained, the mesonephric ducts and ureteric buds connect to the posterior bladder wall and form a part of the trigone. Mesonephric ducts are there, and what else is there? Ureteric buds. Mesonephric ducts, ureteric buds. Okay, they connect to the posterior bladder wall. How are they connected? They are connected to the posterior bladder wall and they form a part of the trigone. So these mesonephric ducts and ureteric ducts, they connect to the posterior wall and form a part of the trigone. The mesonephric ducts, they migrate ventrally. So which are migrating ventrally? Mesonephric ducts, they also migrate ventrally and come together to give rise to the urethra. So urethra is formed from the mesonephric ducts. Mesonephric ducts and ureteric buds, they form the posterior bladder wall and form a part of the trigone. Urachus is later developing into fibrous cord and the median umbilical ligament. The base of the allantois, it expands and develops into the bladder, while its anterior portion gives rise to the urachus. The cloaca divides into urogenital sinus ventrally and the anal canal dorsally. And the blood supply and lymphatics of the bladder. The superior and inferior vesical arteries provide the blood supply to the bladder. So which arteries? Superior and inferior vesical arteries. Which arteries are there? Superior and inferior vesical arteries. They provide the blood supply. So these are indirect branches of the internal iliac arteries. So the superior and inferior vesical arteries, so these are the indirect branches of the internal iliac arteries. Okay, and apart from the superior and inferior vesical arteries, which are branches of the internal iliac artery, they also receive some of its blood supply from the obturator artery and the inferior gluteal artery. So the bladder also receives some of its blood supply from the obturator artery and some also from the inferior gluteal artery. In some cases, the inferior vesicle artery may be a branch of the internal pudendal artery. Instead of coming from the internal iliac artery, inferior vesicle artery may be a branch of the internal pudendal artery. Apart from the superior inferior vesicle arteries, also some blood supply from the obturator artery and also from the inferior gluteal artery. Blood is drained from the bladder via the vesical venous plexus. So from the bladder, blood is drained via the vesical venous plexus, so it will drain into the internal iliac vein. Okay, and lymphatics are drained via various lymph nodes associated with the veins in area, with most of the drainage occurring via the external iliac lymph nodes. So lymphatics are draining into the external iliac lymph nodes. Bladder. The bladder receives its innervation through a network of parasympathetic, sympathetic and somatic nerve fibers. So the bladder, it is receiving its innervation through network of parasympathetic, sympathetic and somatic nerve fibers. Sympathetic, parasympathetic and also the somatic nerve fibers. So parasympathetic fibers, okay, so these parasympathetic fibers arise from the sacral spinal nerves S2 to S4 that coalesce to form the pelvic splanchnic nerves. What is the parasympathetic supply of the bladder? The parasympathetic fibers, they arise from the sacral spinal nerves S2 to S4 that coalesce to form the pelvic splanchnic nerves in the pelvis, pelvic splanchnic nerves. Sympathetic control arises from the sympathetic control arises from the lower thoracic and upper lumbar spinal levels. Parasympathetic from sacral spinal nerves S2 to S4, they form the pelvic splanchnic nerves. Sympathetic control arises from the lower thoracic and upper lumbar spinal levels T10 to L2 in the form of the superior and inferior hypogastric plexus, okay, and nerves. So this sympathetic control arises from the lower thoracic and upper lumbar spinal levels T10 to L2 in the form of the superior and inferior hypogastric plexus and nerves. So superior and inferior hypogastric plexus and nerves. The pudendal nerve S2 to S4, okay, pudendal nerve S2 to S4, it is a branch of the sacral plexus. So which is the branch of the sacral plexus which is innervating the bladder, pudendal nerve S2 to S4. It provides voluntary somatic control to the striated muscles of the external urethral sphincter. Okay, so this pudendal nerve, no, it's a branch of the sacral plexus. It provides voluntary somatic control to the striated muscles of the external urethral sphincter. Voluntary somatic control to the striated muscles of the external urethral sphincter. Pudendal nerve S2 to S4. So these fibers originate in the ventral horn of the sacral spinal cord. So where are these fibers originating? From the ventral horn of the sacral spinal cord, so which is called as Onuf's nucleus. So this nucleus is called as Onuf's nucleus. So the mechanoreceptors in the bladder wall respond to the stretch of the muscle with distension. Supposing so much of urine is filling the bladder, so there will be a bladder distension. So because of that bladder distension, what is happening? The mechanoreceptors in the bladder wall are responding. So these receptors, no, they send sensory information. So what is given? Sensory information to the central nervous system via the general visceral afferent fibers of the hypogastric plexus and pelvic splanchnic nerves. So they are giving information through the pelvic splanchnic nerves and also through the hypogastric plexus. So it general visceral afferent fibers. Okay, so sensory information from the superior bladder wall follows the path of the so from sensory information from the superior bladder wall, no, it follows the path of the sympathetic innervation, that is hypogastric plexus, and while that from the inferior part of the bladder wall it follows the parasympathetic nerves, that is through the pelvic splanchnic nerves. So the speed of the stimulus sent back to the CNS corresponds to the degree of the distension of the bladder, such that a mildly distended bladder will generate so stimuli, while a fully distended bladder, no, it will increase the speed of the stimuli to the CNS. Fully distended bladder, it will increase the speed of the stimuli to the CNS. The micturition center, which regulates the process of bladder filling and voiding, is located in the pons of the brainstem. Pontine micturition center. The micturition center. So where is the micturition center, which is regulating the process of bladder filling and voiding? It is located in the pons of the brainstem. It is the pontine micturition center. In general, the parasympathetic response, it stimulates bladder emptying. So bladder emptying means it is a parasympathetic response. Okay, bladder emptying means it's a parasympathetic response, and sympathetic response, no, it promotes bladder filling. Parasympathetic means bladder emptying and sympathetic response means bladder filling. So parasympathetic nerves, no, it stimulate the detrusor muscle. Okay, bladder should empty because of the parasympathetic nerves. So parasympathetic nerves, they stimulate the detrusor muscle to contract. Okay, if contraction, and the internal urethral sphincter to relax, to allow for the micturition. Okay, parasympathetic nerves, they stimulate the detrusor muscle to contract and internal urethral sphincter to relax to allow for micturition. So for voiding, what should happen? Detrusor muscle should contract and internal urethral sphincter should relax. Sympathetic stimulation, no, it allows for relaxation or filling of the detrusor muscle and constriction of the internal sphincter. So sympathetic stimulation for relaxation and constriction. Local spinal reflexes primarily regulate the process of bladder filling. Local spinal reflexes, okay, local spinal reflexes primarily regulate the process of bladder filling, and that of voiding, however, requires, if patient has to void, requires action from the pontine micturition center in the brainstem. So however, the sensory nerves are carried through mechanoreceptors will be there. So from that mechanoreceptors, the general viscerant fibers, both of the hypogastric and pelvic splanchnic nerves, no, that is conveyed to the sensory information, some superior bladder wall by sympathetic innervation and inferior part by parasympathetic nerves. And as an empty bladder fills with urine, okay, empty bladder is filling with urine, so what is done is mechanoreceptors, no, they detect the stretch in the wall of the detrusor muscle and send the slow afferent fibers back to the afferent fibers, no, sensation to the spinal cord. So this stimulates the sympathetic response on the detrusor and internal sphincter via the hypogastric nerves, causing them to relax and constrict respectively. So when sympathetic is active, parasympathetic is inhibited at this time. And signals from the pudendal nerve to the external urethral sphincter are also stimulated to keep the external urethra contracted and closed. So this pudendal nerve, so the signals from the pudendal nerve to the external urethral sphincter, so these are also stimulated to keep the external urethra contracted and closed. So when the sympathetic stimulation is causing the internal urethral sphincter is closed, and even the pudendal nerve, signals from pudendal nerve to the external urethral sphincter are also stimulated to keep the external urethra contracted and closed. So when bladder is fully distended, sensory fibers travel to the pontine micturition center, and then we have this parasympathetic response is occurring, inhibiting the sympathetic tone to allow for the contraction of the detrusor muscle and relaxation of internal sphincter. So throughout this, somatic innervation to the external urethral sphincter remains tonically active to keep the sphincter contracted. When voiding is appropriate, so when it is appropriate, so this activity from the pudendal nerve, it is inhibited. So this will allow relaxation of the sphincter, and this will cause the release of the urine. So stimuli sent to the cortex during the filling process also play a role in voiding. Okay. So stimuli sent to the cortex during the filling process also play a role in voiding. So the cortex processes emotional, sensory and social stimuli and acts on the cells in the PMC and periaqueductal gray to prevent voiding until the appropriate time. So apart from this, the cortex also, stimuli sent to the cortex during the filling process also play a role in voiding. So the cortex processes emotional, sensory and social stimuli and act on cells in the PMC and the periaqueductal gray. Okay, it acts on the cells in the PMC and pontine micturition center and periaqueductal gray to prevent voiding until the appropriate time. So appropriate time should be there for voiding. And then muscles. The detrusor muscle is the primary muscle of the bladder. So which is the primary muscle? Detrusor muscle is the primary muscle of the bladder. So it is divided into body, fundus, apex or dome and neck. Okay, the detrusor muscle is the primary muscle of the bladder. It is divided into the body, fundus, apex or dome and neck. So detrusor muscle, it is a smooth muscle. It is composed of transitional epithelium or urothelium. Detrusor muscle, it is a smooth muscle, okay, composed of transitional epithelium or urothelium. So transitional epithelium is a stratified epithelium. Transitional epithelium, it is a stratified epithelium and its cells change shape depending on the volume of urine in the bladder. Transitional epithelium, it is a stratified epithelium and its cells will change the shape depending on the volume of urine in the bladder. So when the bladder is empty, the cells of the When the bladder is empty, the cells of the urothelium are round and large. So when bladder is empty, what will happen is the cells of the urothelium are round and they are large cells. As the bladder is filling with the urine, the cells will transit into a flatter cells to accumulate a greater volume of urine. And detrusor wall contains muscarinic M3 receptors for parasympathetic control Which receptors? M3 receptors for parasympathetic control, and it contains beta adrenergic receptors for sympathetic regulation. So for sympathetic regulation, it is beta adrenergic receptors for sympathetic regulation. So the internal urethral sphincter is found in the neck of the bladder leading into the urethra. The internal urethral sphincter, no, it is also composed of smooth muscle cells, and this contains the alpha adrenergic receptors for sympathetic regulation. So stimulation of this so internal urethral sphincter, smooth muscle cells, and alpha adrenergic receptor. So stimulation of this receptor, no, it allows constriction to allow for bladder filling, and disinhibition causes relaxation. The external urethral sphincter, no, external urethral sphincter, it's composed of striated skeletal muscle. So which muscle is there in external urethral sphincter? Striated skeletal muscle. So nicotinic receptors are found on these cells under the control of the pudendal nerve. So nicotinic receptors. So which receptors are there on this external urethral sphincter? Nicotinic receptors under the control of the pudendal nerve. So this pudendal nerve, no, it contains somatic nerve fibers that constantly fire to keep the sphincter contracted until the appropriate time to void. So during toilet training, no, humans learn to voluntarily control the regulation. They voluntarily control the regulation of the external urethral sphincter to prevent voiding at inappropriate occasions. So the development of voluntary control of micturition, it is a highly complex process that involves many levels of the brainstem, spinal cord, and peripheral nerve system. So infants and children, no, they lack the voluntary control of urination until their nervous system develops. So until their nervous system develops, so typically between 2 to 4 years of age. So prior to this, no, how does this voiding occur? Via the spinal reflexes activated when the bladder reaches a specific volume. So when bladder reaches a specific volume, what will happen? Spinal reflexes are activated.